Dr. Nick Circolone is here this morning from Apple Chiropractic, Orthopedic and Rehab, and as he sat down just now, he said, "You're breathing wrong." So, welcome. No, but we're talking posture and how it affects your overall health, and I am a big believer in that. I know I flunk at it too often.
You do pretty good.
I try, but it's a problem, and I look around me, my kids included, and we seem to increasingly do this.
Of course, it's one of those things where, well, you know, we have our phones with us, we have our laptops, you know. People don't have desktops anymore, they have their laptops, so it's easier to lean back into your laptop or lean forward. My posture's bad when I'm using my laptop too, so I have to admit that. So okay. I have to watch it. I have to watch how I breathe.
You picked this topic, though, because you thought it was a pretty good tie-in to the game on Sunday.
Yes.
Why? Because football players are having to always watch that posture?
Well, you know, not only their posture, but their balance. You know, posture and balance go together for good health. You know, and what happens is a lot of times you'll see these football players doing yoga and other balance type techniques to help improve their game, because if your balance is right, your form is better when you're playing that game. And not only that, but you play better. You become more, I guess, marketable for some of these guys.
Sure.
So they're going to do everything that they possibly can in order to make them marketable and play better at a game.
Okay, I know you want to give us some suggested ideas, but I have to ask you something.
Sure.
Is it true that if your posture is poor, and everything in your body is interconnected, right? So if things begin to shift on you, doesn't that ultimately go up and affect even how your brain functions and your thinking and everything?
Absolutely, but what we're seeing more of is people being sedentary. So if the more sedentary they are, the worse their posture is. So now we're having other problems such as like heart disease, lung issues, because we're starting to collapse all of this stuff just because of poor posture.
Okay, so
get up and move. That's basically what.
Let's get to how I'm breathing wrong.
Okay.
I wore a big old sweater so you can't see my stomach as easily, but what am I doing wrong?
Most people, 90% of the people breathe from their chest. They'll breathe big and deep. Well, they're not even using their core muscles when they breathe. If you've sang, if somebody taught you how to do a proper exercise, you always breathe from your belly. That engages
from your diaphragm.
Exactly. That engages the core muscles. Those pelvic muscles will pull down, start to strengthen. And what happens is not only will it strengthen the pelvic muscles and the abdominal core muscles, but it also works on the back muscles. There's a lot of people, it's called the transverse abdominis muscle. You know the rectus abdominis? Everybody knows what that one is because that's your six-pack. But the transverse abdominis is so neglected. I've had patients come in with these wonderful six-packs with terrible back pain. Why?
Is this why my college-age daughter has me doing this push-up challenge, this 100-day push-up challenge? So I've gone from being able to do 12 to I can do 35.
All right.
Okay, I'm rocking it. But I can tell after I get up a ways, I feel it in my stomach. Is that why? Because I'm breathing the right way?
Well, no, because you're using your abdominal muscles to hold that position of the push-up. Because what a push-up is just a plank with motion.
Okay.
So you're doing that. And now, you may not be working all the right muscles. That transverse abdominis doesn't get worked really well. And if you saw early in the video, I have some of my patients working on a ball. Little things will actually make a difference in the way your posture functions if you're doing little things. Right here, she's doing a Superman and she's blocking that, but she's focusing on that pelvic area, which is making her tighten that area up. This person in particular was having a lot of back pain when they would exercise. So I changed the way they exercise. I gave them a different method as they're doing those exercises, and their back pain doesn't hurt.
Okay, Nick, so if people are watching you and they think, okay, I know you mentioned the football players doing some classes in yoga and things like that, but can people come to you and say, can we talk? Here's what I'm experiencing. Can I come to you and you can kind of guide me through some steps to do at home?
And we do. And see, that's the beauty about my office. What we do is, not only am I treating you for back pain or neck pain or other musculoskeletal pain, but I'm giving you stuff that you can do at home that keeps you out of my office.
What if it's not pain that you have yet? What if you just are, you have a bad habit? Or what if you have a weight problem or something like that and you think that the posture is possibly playing a part?
We can help improve that. But I will be honest with you, most people have pain of some sort. It might not be as bad where it says, oh, I need to do something about it. It might be waking up in the morning and going, I'm just stiff for a few hours. And then after I walk around, I feel better. Some patients, they say, you know, I can't get out of bed. I go to use the bathroom, but by the time I get back to the bed, I'm fine.
Okay.
Well, there's reasons for all of that. And that's where the posture comes in, and that's where we start training these muscles. The big game's coming up on Sunday. I guarantee the ball that you saw that patient on, they're using those same balls in the training room for these extreme athletes.
Okay.
Because they want to make sure, number one, that they're not going to injure themselves doing some of the exercise, and number two, that they do it properly. And when you use a ball, you're able to get those muscles firing specifically without getting other muscles involved as well.
So as we give your contact information, tell me if I'm right in what I'm hearing you say, that if someone's watching, they want to call you there on Shallowford Road, they can come in, meet with you, tell you where the pain is, what they've maybe been doing to try to offset it, what they haven't done, and what their ultimate goal is, and you'll design a program for them.
And we could. And you know, the other thing is, if they're hurting when they exercise, they may have to change something, and we can work on that as well.
All right, that's where you're going to find him. 855-7376, applerehabgroup.com, right near the Hamilton YMCA over on Shallowford Road. Thank you, Nick.
Thank you.
We're back after this.